darkness, when every light has faded, behold a glimmer of hope for those who face life's most dire fate.
Now, let's invite Team SA as they share their in-depth research on palliative care.
Her heart racing like a runaway train. Unseen what battle she faced, flipping through the pages, a new journey she embraced. Her dark eyes were a gift of the dark night, looking for something light. Dark is the night, but never mind, as long as love will make it right. I call my heart, my soul to hear a body that sings in grief. In tunnels of panic, angst, and isolation, flickers a candle of consolation. A doctor betokens a flip, a zigzag that calls the slip. So, as nothing ends, begins something new.
The World Health Organization defines palliative care as an approach to improve the quality of life of patients and their families facing life-threatening illnesses through prevention and relief of suffering by means of early identification, treatment and assessment of distressing problems, be it physical, psychosocial or spiritual. Being diagnosed with a terminal illness affects the lives of the person with the diagnosis and their caregivers. Palliative care is a means to cater the needs of the ones in a war with death. The physical dimension of palliative care is centered on managing symptoms and discomfort that often accompany a serious disease. Chronic pain is managed by care teams by judging the level of pain and by assessment tools and scales and then develop management plans. Often, patients require multiple medications for other symptoms like nausea, vomiting, loss of appetite, and dyspnea, with complementary therapies like nutritional therapy and respiratory therapies. As the patients progress in their illness, the focus of care shifts from providing curative treatment to end-of-life support and comfort.
Mental health and support is important in every stage and season in life. Some people experience frank depression or anxiety disorders during their end of life, but for many, the distress is existential. There is likely to be a range of emotional disturbances in the patient and their family members. The psychosocial aspect of palliative care is a lifeline for maintaining the mental health and emotional well-being of the patient. A team of doctors, nurses, social workers, and counselors come together to address the patient's emotional distress, offering a compassionate ear and a guiding hand. Regular assessment of development in their emotional symptoms, functioning, and self-reported well-being is a crucial step in this aspect.
The real complexity of life, ironically, lies where practicality and rationale does not provide solace. Spirituality is a fundamental pillar of palliative care. A multifaceted team of social workers, nurses, and faith leaders working in unison to help create bridges for those who want to reconnect with their faith or for those who lack of it. Spiritual tools such as hope allows us to remove patients from an existential or a nihilistic state of mind, all caused due to the uncertainty of death knocking on their doors. With spiritual aspect, we hope to increase the quality of life of the patient rather for them to just exist in it. For we believe that man lives two lives. The second one starts when he realizes he has just one.
Palliative care gives patient an option for parents in the management and higher quality of life while still pursuing curative measures. Patients' immediate relations affected must be tended to, rehabilitated, and educated about the predicament and created. Given that palliative care isn't widely spread in our country, brings a lot of questions into life. Why has there been delay in bringing it to our population? Why is the general public unaware of the system despite us living in a house of abundant information? We agree, some individuals are informed about it, but widely limited to tax funding. Hence, a research study was done to establish current knowledge level of palliative care among categories of patients with life-threatening diseases and their knowledge practice.
Few of the objectives set for the research, an observational cross-sectional study was conducted in 6 tertiary health centers across the city of various socio-economic strata. The target population included family members of patients suffering from diseases like stroke, dementia, congestive heart failure, end-stage renal disease, chronic obstructive pulmonary disease, cerebral palsy, and cancers like breast cancer, multiple myeloma, colon cancer, lung cancer, and lymphoma. A sample size of 304 was selected using convenient sampling technique. We collected data through a face-to-face interview using a pre-tested questionnaire. The data was expressed in frequencies and percentages, and chi-squared test was carried out to analyze variables with p-value set at less than 0.05 using SPSS.
Out of 340, 61% were males and 39% female participants of ages all about 21 years. Most of the study population were graduates and postgraduates, accounting for 67%. The next series of questions tested about the knowledge of palliative care among caretakers and factors regarding it.
The participants were inquired about their level of knowledge, and 79.9% of them had no knowledge, 16.4% had some knowledge, and only 3.6% were very knowledgeable. The majority of the family members with knowledge of palliative care were either healthcare professionals or had a friend or relative receiving it. These findings underline the significance of healthcare physicians and workers in raising community awareness of palliative care. Medical students and physicians are a reliable source of information, while media platforms help in disseminating this information to the bulk of the society. Another part of the study assessed the association of level of knowledge with gender, education, and income. We found no neutral correlation between them with no statistical significance.
While 21.7% of the participants believe palliative care extends longevity, 27.7% of the participants were aware that it aids in enhancing the quality of life. This demonstrates the lack of understanding of the goals of palliative care in the state of Telangana. Irrespective of level of awareness, 80.2% of the participants believe spiritual support before or after patient's death is an essential component, laying emphasis on the deep-rooted divine beliefs and reverent convictions people hold regarding individuals' life and health in a country like India.
To know what the families expected palliative care teams to do for them is an indirect indicator of their willingness to practice. Hence, when asked, 29% of them wanted nurse assistance at home, 28% wanted their symptoms to be managed at home, while 24% preferred aid over a call. Another part of the study examined how the patient's family members evaluated the goals of palliative care.
When we asked the participants what exactly do they want information about palliative care, 84.2% of them wanted information generally available, 8.6% wanted information only when they are diagnosed with a life-threatening illness. The rest of them either wanted no information or wanted information only if they are diagnosed with a life-threatening illness. However, opening up the floodgate and making accessible information to caregivers and palliative care patients will equip them with knowledge, empowering them and illuminating their path for empowered and informed decisions in the realm of treatment.
Ladies and gentlemen, today we have witnessed the instrumental impact of palliative care, but the path to such a treatment still remains crooked. An estimated 5.4 million patients are in need of palliative care, with less than 2% of them receiving its treatment. India ranks at the bottom, 87th in position in quality of life and death index. So I turn to the audience and ask, until when are we going to rely only on outwards for pain management? We have dug their graves as soon as we give them a diagnosis. But do not despair, for we still have hope. Ever since its inception in 1994, the Indian Association of Palliative Care has outshooted over 150 nationwide programs. The prominent one of these being Cancer Board in New Delhi, providing teams, 11 care teams. The Coordinating Pain Palliative Care Society in Assam for those with liver disease. The Chandigarh Pain Palliative Care Society in association with the Indian Red Cross. And the Ankur Memorial in Ernakulam, Kerala, working for patients with terminal illnesses, Gurse cirrhosis, comatose patients 24/7, 365. And what about our beloved city of Hyderabad? Converse with doctors and physicians along with the family members of the terminal care who all pointing the finger towards one singular aspect, the sheer lack of awareness and lack of infrastructure for palliative care. Our
Dedicated healthcare workers with a sense of determination to embrace the true sense of compassion. The light shines upon those in darkness, illuminating a holistic approach to care. And so, dear friends, let the curtains fall upon this chapter, knowing that this is not the end. This is merely the beginning.
Let us come into creating a world where compassion knows no bounds.
And palliative care continues to be a whisper of solace in your darkest hours.
Thank you.
Thank you.
Did you not include the government hospital in Telangana which provides palliative care? Which is the government hospital which is providing palliative care?
Thank you so much for the question, ma'am. We were looking into MHA when we spoke with none other than Kalki ma'am here. And we also went to Kumandi Devi, which is in association with MHA. It is actually run by an NGO, Palliative Care Society. We talked with Dr. Manjula over there. And over there is the same issue, ma'am. The sheer lack of infrastructure that is definitely needed for patients who require palliative care, not only for cancer, but for other chronic diseases with terminal prognosis.
Yeah, so Dr. Gayatri is there and one of the pioneers of palliative care and in MNJ, and they are doing a fantastic job. So tell me, what components of palliative care did you ask the patients about? What components of palliative care?
So thank you so much for the question, ma'am. We divided our questionnaire to assess the three aspects or the three dimensions of palliative care. So we were talking about the physical approach, the physical dimension, then the psychosocial dimension, then the spiritual dimension, pertaining to all of these questions which were correlating towards these dimensions.
So when we answered the question, ma'am, when we asked about physical aspect, we asked, does palliative care completely cure the disease, or does palliative care totally release all types of pain? For psychosocial, we asked questions about do they need spiritual support, or in case of what palliative care options they are requiring, do they need someone to talk for their moral boost? These were the questions we asked to find out the different aspects of palliative.
So I think your study is relevant to ask the relatives, but did you ask the doctors, as you rightly pointed out, in fact in the last slide, that even doctors are not aware of the existence of palliative care. So what palliative care support services are provided free from the government? Are you aware of that? And the patients, were they aware of that?
Thank you so much for your question, ma'am. A senior consultant in Basavaka from Indo-American Hospital, the one introduced, did mention that he was running his department of pain and palliative care medicine for 10 years, and in his experience he has seen that though many people want to perform palliative care, they do not have the qualifications, since palliative care here in India is only 20 years old. Apart from this, he did mention that majority of the physicians do not know the true potential of palliative care, restricting it only towards pain management or cancer.
So palliative care should be attended to at the end or from the beginning of a disease?
I'm sorry.
Is there a role for palliative care from the diagnosis of disease?
Palliative care has two main dimensions. One is the curative treatment, one is the pain management treatment. So we have two bars over here. As the disease progresses onto its terminal diagnosis, the role of curative treatment decreases, but the one of palliative care increases, the pain management aspect. So palliative care by definition can be given on any onset of chronic disease with a terminal prognosis, but the curative part will definitely play a strong role in this.
Among their caretakers primarily.
Did you ask about any questions like were they ready to discuss about death or dying patients or family members? This is very important for aspect of the palliative.
Yes, ma'am, definitely. Thank you for the question. Yeah, we found they were very reluctant to discuss about death and dying. This was a very culturally sensitive topic, and they were reluctant to talk about even if they were diagnosed with a disease.
Can I just add a point to that, ma'am? May I just add a point to that? Right. So the real essence of palliative care over here for the general perspective is we got a positive response from them. But the real unfortunate incidence is that many people believe that palliative care means it's a death sentence. That means our relatives are gonna die, help us in order to prevent that. That is not the issue. With here with palliative care, we're providing the curative treatment along with various other approaches in order to increase their spiritual and psychosocial, not to fall in depression. And palliative care does not restrict to the patient. The unique property of palliative care is that it extends to the family members also. So we're not leaving only one. Cure a patient with palliative care, you're curing not only a patient but an entire family.
Nice presentation. Keep up the good work. Madam is there, so she will be asking more questions on palliative.
Thank you very much. Congratulations. Thank you so much that you decided to take this subject to OSMECON research as a sample for your, to explore the knowledge. You could have gone to wider population or health workers. Was it for the sake of convenience or what made you think that let's speak to the two?
Yes, ma'am. Thank you for the question. I think it was the timing that I made of the study to approach caregivers rather than having doctors with us, because we found that they would be a lot more busier than other patients and would not be able to help us with our study.
And suppose you're going back to your college now after all this fest, and what is that one thing you're going to do in your own college to raise awareness of palliative?
Thank you for the question. Yes, we would like to start CMEs and programs, awareness programs with our mentors and form clubs in our college.
Might I just add one, ma'am, if I...
To add a point to the previous question, ma'am, when we go into the patients and their family members, the patients were quite hesitant to answer our questions. So that's why is also a factor that we consider caretakers more than the patients. And also they were not in the right state of mind hearing of their diagnosis.
To answer now to this question that you were stating, ma'am, thank you so much. The real aspect of palliative care in terms of for the college is that number one issue is that we have in certain states, the central government has initiated various nice programs for palliative care, but the state government response is very poor. There is such a clear disparity within the palliative sector in the northern side as compared to the southern side, especially the model one being Kerala. So our first objective is for NMC to introduce postgraduate courses in palliative care. Majority of the people who are entering into palliative care are going through either anesthesiology because that deals with opioids and pain management, and from that they're entering into pain relief, as was seen in Spurs Hospice as well as Basavathapram. So I believe that is the number one ordeal, is that National Medical Council should introduce postgraduate courses in order to truly assist palliative care.
To correct here, in year 2011, MD in palliative medicine started.
Yes.
And 2022 we started DNB in palliative. 2021 DNB in palliative medicine already started.
Yes.
So already got students doing post-graduation. This for correct.
That is true, ma'am, and I obviously you know better. But still, yeah.
Anyway, thank you. Thank you very much and congratulations.
Thank you so much.
Thank you so much.